Okay, let's unpack this. Imagine your pet, your furry best friend, suddenly having serious trouble breathing, maybe coughing or really struggling. It's a terrifying thought, right?
It really is.
And a potential quite severe cause that pet owners might not even consider is something they accidentally inhale.
That's absolutely right. Today, we're doing a deep dive into a condition called aspiration pneumonia. It happens in dogs and cats.
Aspiration pneumonia. Sounds pretty clinical.
It does, but essentially, it just means inflammation in the lungs, a serious inflammation.
And it's triggered specifically by inhaling things that really shouldn't go down there, like food, water, maybe even vomit.
Exactly. It's not just some simple cough. This can genuinely be life-threatening.
Because those inhaled substances cause, well, significant damage to the lung tissue, I imagine.
Precisely. It's a serious condition because of that direct damage.
So we're drawing today from specific source material, a deep dive into canine and feline aspiration pneumonia. It really lays out the fundamental details, the how, the why, what signs to look for, and, the general approach to treatment.
And our mission, really, is to sort of distill that material for you, pull out the most crucial bits of information so you can grasp what this condition is, why pets might get it, what the signs look like, and what's involved in helping them through it.
Okay, let's unpack this source then. First things first, the core definition. What is aspiration pneumonia, according to this material?
Fundamentally, the source defines it as inflammation of the lungs, and it's caused by inhaling material from the mouth or the throat or even the stomach.
So things like food, water.
Saliva.
Yeah, or stomach contents if they've regurgitated or vomited, anything that should have gone down the esophagus ending up in the airways.
Why does this happen? Don't animals have ways to stop stuff from going into their lungs? Reflexes and things.
They absolutely do, and that's a critical point the source makes. This happens when those protective reflexes, mainly in the voice box, the larynx, aren't working properly. The ones that normally seal off the airway when they swallow or breathe.
Exactly. Either those reflexes function improperly or they just get completely overwhelmed by the sheer amount of material coming back up or trying to go down.
Okay, here's where the source says it gets really interesting. It's not just one type of damage when something gets inhaled, right? It breaks down 3 distinct ways this causes problems in the lungs.
Yes, it's like a multi-pronged attack, unfortunately. First, there's airway obstruction. Pretty straightforward.
The inhaled stuff just blocks the tubes?
It can physically block the smaller breathing tubes, yeah. But the source also notes it triggers this reflex tightening, a bronchospasm, and the body churns out mucus and inflammatory fluids, exudate, which blocks things up even more.
Okay, so a physical blockage plus the body kind of overreacting and making it worse. Got it. What's the second way?
The second major issue, and this is especially if it's vomit or stomach contents, is chemical injury, specifically from gastric acid.
Stomach acid in the lungs. Ouch.
Yeah, it's very harsh stuff. Inhaling it directly damages the delicate lining of the airways. The source says this acid damage can cause really severe inflammation, more airway tightening, and in the worst cases, it can lead to something similar to ARDS in people at Shaft. Acute respiratory distress syndrome, a really dangerous condition.
Wow. So the acid essentially burns the airways. That sounds awful. And the third mechanism?
The third one is bacterial pneumonia. There are always bacteria in the mouth and the digestive tract.
Right, normal flora.
Exactly. So when those get inhaled along with the food or vomit, they can set up an infection right away. Or sometimes infections develop a bit later because the initial damage from the aspiration, the acid burn, it all makes the lungs much more vulnerable to bacteria that might get down there.
Okay, so physical blockage, chemical burn, and bacterial infection. A real triple threat to the lungs. Now, who typically gets this? The source mentioned something about dogs versus cats.
That's right. The source material indicates it's primarily seen more often in dogs. It does happen in cats, but it seems to be less common.
Okay. And what signs might you, as a pet owner watching your dog or cat, actually see if they develop aspiration pneumonia?
Well, the signs can pop up very suddenly. That's peracute or more acutely, or sometimes they can develop more slowly, kind of chronically.
So it varies quite a bit.
It does. But common signs include things like coughing, definitely, rapid breathing, the technical term is tachypnea, maybe some nasal discharge, or just getting tired really easily during exercise, exercise intolerance.
And what about more severe signs? When should you be really worried?
If it's getting severe, you might see obvious respiratory distress, like really visibly struggling to breathe, or cyanosis.
Cyanosis.
That's a bluish tinge to their gums or tongue. It means they're not getting enough oxygen, which is a serious emergency.
Okay. And you mentioned earlier the signs can also point back to the original problem, the reason they aspirated in the first place.
Absolutely. The source highlights this. You might see signs related to why the pet aspirated. Things like, well, regurgitating food that's different from vomiting, or vomiting itself, difficulty swallowing, which is called dysphagia,
Okay.
or maybe they seem sort of disoriented, an altered state of consciousness, or they might be making unusual breathing sounds like snoring type noises, stertor, or high-pitched sounds when they breathe in stridor.
That makes a lot of sense. This signs aren't just the lung infection itself, but also clues pointing towards that underlying issue that allowed the aspiration to happen. Which brings us neatly to, why does it happen? What are these underlying problems and risk factors? The source apparently has a pretty extensive list.
It really does, and understanding the root cause is just so critical, not only for treating the pneumonia itself, but especially for trying to prevent it from happening again. It really raises that key question. What was the underlying issue here? The source groups these predisposing factors into several logical categories.
Let's try and walk through those, focusing on the types of problems they represent. First up, issues with the pharynx, that's the back of the throat area involved in swallowing.
Yes, exactly. Problems here could include weakness or even paralysis of the muscles involved in swallowing. Sometimes it's just local in the throat, or it might be part of a bigger generalized nerve or muscle disease affecting the whole body.
Okay.
Other pharyngeal issues could be a specific problem with a muscle that helps open the esophagus, or maybe even anatomical issues the pet was born with, malformations.
Okay. Next category, problems with the esophagus itself. The tube carrying food down to the stomach.
This is a really common category the source mentions. Big one here is megaesophagus, where the esophagus is abnormally enlarged and kind of flaccid, doesn't push food down well.
Right, I've heard of that.
Also, inflammation from chronic acid reflux esophagitis, problems with the actual muscle contractions that move food down, that's esophageal dysmotility, physical blockages in the esophagus, or even rare things like abnormal connections forming between the esophagus and the airway, a bronchoesophageal fistula.
Wow, lots of potential issues there.
Yeah.
What about the larynx, the voice box you mentioned, its protective role?
Yeah, the larynx is vital. So problems there are big risk factors. Laryngeal paralysis is a major one where the flaps, the arytenoids, don't close properly during swallowing or open properly for breathing.
Okay.
Other issues could be things like scar tissue forming webs, physical obstructions like masses, or maybe complications after having surgery in that area.
Altered consciousness is also listed as a risk factor. That seems logical.
Definitely. Any state where the pet's normal protective reflexes like coughing or gagging are dulled or suppressed. This is precisely why aspiration is a known risk with sedation or general anesthesia.
Makes sense.
But it can also happen after a seizure, post-ictus, or with certain brain diseases, or even metabolic illnesses that affect brain function and awareness.
And finally, the source mentions iatrogenic causes, which means problems caused unintentionally by medical treatment.
Yes. Things like maybe force feeding if it's not done very carefully, incorrect placement or use of feeding tubes, or even administering certain liquid medications or supplements by mouth, like mineral oil for constipation, if it accidentally goes down the wrong way.
So a really, really wide range of potential issues. Nerves problems, muscle problems, physical blockages, anatomical things, sedation effects, even treatment side effects.
Yeah.
All potentially interfering with those crucial protective reflexes.
It's a long list.
Okay, so how do vets actually figure out if a pet has aspiration pneumonia? And just as importantly, try to pin down what caused it. Let's talk diagnosis.
Right. Well, first they need to consider other things. It could be differential diagnoses, like other kinds of bacterial pneumonia, maybe even a lung abscess. Then they move into the actual diagnostic tests.
What sort of lab tests are typically run first?
Standard blood work, a CBC and biochemistry profile, maybe a urinalysis. These give a general picture of the pet's overall health. They can show signs of infection or inflammation, like the source mentions potentially seeing an increase in certain white blood cells, neutrophils often, sometimes with immature ones indicating a strong response, a left shift.
But not always.
No, sometimes the white blood cell counts can actually be normal, surprisingly, so it's not definitive on its own.
Any more specific lab tests?
To get a direct measure of oxygen levels, vets might do an arterial blood gas analysis. The source says pets with AP often have low oxygen in their arterial blood, hypoxemia. Carbon dioxide levels are usually low too because they're breathing fast.
Okay.
And then they might run more specific tests to investigate those potential underlying causes we talked about. Things like tests for myasthenia gravis, which affects nerves and muscles, maybe hormone tests like cortisol levels for Addison's disease, or muscle enzyme tests like creatine kinase. Depends what the history and other signs suggest.
Imaging sounds like it would be absolutely key here. X-rays.
Oh, definitely. Thoracic radiographs test X-rays are crucial. Aspiration pneumonia often creates a particular pattern on the X-rays, what's called a bronchoalveolar pattern.
And where does it usually show up?
This is a fascinating detail the source points out. Because dogs and cats spend a lot of time lying down, gravity plays a role. The pneumonia pattern is often worst, or most obvious, in the lung lobes that are lowest down when they're resting.
Gravity-dependent lobes.
Exactly. So typically that means the right cranial and right middle lung lobes and the left cranial lung lobe.
That's interesting how gravity affects where the inflammation settles. Does it appear on the X-ray immediately after they inhale something?
This is a really important clinical insight from the source.
Yeah.
It can actually take up to 24 hours for that characteristic pattern to fully develop on the X-ray after the aspiration event has happened.
Wow, 24 hours. So an initial X-ray right after you think it happened might look normal.
It could, yes. Which is why follow-up X-rays can be important if suspicion is high. The source also stresses that vets need to scrutinize the X-rays not just for the pneumonia pattern, but also for any evidence of those underlying issues, like an enlarged esophagus or other problems in the chest cavity.
What about those studies where they watch the pet swallow using X-ray video?
The video fluoroscopic swallowing study, often called a barium swallow study, though they might use other contrast agents. It can be incredibly informative.
How so?
It lets the vet visually see in real time if there's dysfunction during the swallowing process or if the esophagus isn't contracting and moving things along properly. It can provide direct evidence of a predisposing factor.
Sounds very useful. Any drawbacks?
Well, the source does include a caution. There's a small risk that the pet could actually aspirate the contrast material during the study itself, so it's weighed carefully.
Right, a diagnostic tool with its own small potential risk.
Okay.
Any other procedures commonly used?
Well, to identify the specific bacteria causing the infection, if there is one, and figure out which antibiotics will be most effective, the source strongly recommends performing a tracheal wash or a similar airway sampling procedure.
To get a sample directly from the airways.
Exactly. For bacterial culture and sensitivity testing. And crucially, this should ideally be done before starting antibiotics so the results aren't skewed. The source notes that these infections are often polymicrobial, meaning multiple types of bacteria are involved, and their susceptibility to antibiotics can be unpredictable. So culture is really helpful.
Makes sense. What about using a scope, like a camera, to look directly into the airways?
Bronchoscopy.
Bronchoscopy is rarely needed just for diagnosing the pneumonia itself, according to the source material. It might be used in complicated cases or if other things are suspected, but not routinely for AP.
And checking that laryngeal function you mentioned earlier, how the voice box is working. A laryngeal function exam is vital if laryngeal paralysis is suspected based on the signs, like that noisy breathing or voice change. The source suggests it's often done if the pet is already under anesthesia for another reason, maybe for the airway sampling.
Then it's not.
If not already anesthetized, it's typically performed after the pneumonia has resolved or significantly improved, assuming those signs suggesting a laryngeal problem are still present. You generally want to avoid anesthesia in a pet with active, severe pneumonia if you can help it.
Right, minimize risks.
Okay.
Okay, so you've managed to diagnose the pneumonia, hopefully got some clues about the underlying cause. How is it treated? Let's start with the general supportive care.
Okay. If the pet is having significant trouble breathing, oxygen support is the first priority, along with strict cage rest to minimize oxygen demand.
What if oxygen isn't enough?
In severe cases, if they're not responding well just to oxygen therapy, more advanced respiratory support like mechanical ventilation might be necessary. That requires specialized intensive care.
Okay. Fluids.
Intravenous fluids are usually given, yes, to maintain hydration and circulation, but and the source specifically cautions this, you have to avoid overhydration. Too much fluid can actually leak into the already damaged lungs and worsen the pulmonary edema. So, careful fluid balance is critical.
And food or water by mouth?
Typically, oral intake food and water is withheld initially. at least until that primary underlying problem, like the swallowing issue or whatever caused the aspiration, is identified and managed. You don't want them aspirating again while they're recovering.
That makes sense. Any specific advice about how they should rest? Their position?
Yes, this is a really important practical point the source makes. Do not allow the patient to lie flat out on just one side, laterally recumbent, for more than about 2 hours at a time.
Why is that?
It helps prevent secretions and inflammation from pooling in the lower lung lobes and encourages the lungs to clear fluids more evenly. Regular turning, or keeping them propped up on their chest if possible, is better.
Okay, good tip. Any other things to help clear the airways?
The source mentions a few things. Mild exercise, if the pet is stable enough for it, can sometimes help mobilize secretions. Using a nebulizer to deliver saline mist into the airways can help thin mucus. And then performing coupage, which is gently but firmly tapping on the chest wall, can help loosen secretions so they can be coughed up.
What about actively suctioning material out of the airways?
Airway suctioning is mentioned by the source, but with a very specific caveat. It's only really recommended if it can be performed immediately following a witnessed or strongly suspected aspiration event, like maybe during recovery from anesthesia when they're closely monitored and it just happened. It's not considered a general treatment for established pneumonia days later.
Right. And what about lavage, like actually washing out the airways with fluid?
This source is very clear on this point. Airway lavage is contraindicated, should not be done.
Really? Why not?
It can spread the inflammation and infectious material further into the lungs and potentially worsen the damage. So what's fascinating here is that really clear distinction. Immediate suction may be in a very specific scenario, but active washing or lavage is definitely out.
Got it. Suctioning, rare and immediate only. Lavage. Never. Okay, let's move on to medications. Antibiotics must be key.
Absolutely vital, especially if the pet is showing signs of sepsis, systemic infection, or is severely compromised. The source suggests starting with broad-spectrum antibiotics, often a combination therapy like ampicillin with sulbactam plus a fluoroquinolone given intravenously initially for good coverage.
And then adjust based on tests.
Precisely. The initial choice should then be refined based on the results of that airway sample culture and sensitivity testing, finding out what bacteria are actually there and what drugs effectively kill them, and of course how the pet is clinically responding to the initial treatment.
How long do they typically need to be on antibiotics? It sounds like a serious infection.
It often is. The source recommends continuing antibiotic therapy for a pretty significant duration, for at least 10 days after both the clinical signs like the cough, the rapid breathing, the fever, and the changes seen on the chest x-rays have completely resolved.
10 days after everything looks normal? Wow.
Yes, it emphasizes ensuring the infection is truly eradicated to prevent relapse.
Okay. The source also mentions beta-agonist bronchodilators, drugs that help open up the airways.
Yes, things like albuterol or terbutaline, they can sometimes lead to quite dramatic improvement by relaxing the smooth muscle around the airways, making breathing easier. Especially useful in acute aspiration cases or if there's audible wheezing.
But there's a catch.
There is a potential downside, the source points out. These drugs can sometimes worsen something called ventilation-perfusion mismatch. Basically, they might open up airways in parts of the lung that aren't getting good blood flow, or vice versa, which can paradoxically make oxygen exchange less efficient overall. So they're used, but often cautiously.
Interesting trade-off. What about corticosteroids, like prednisone, anti-inflammatories?
The source suggests short-acting corticosteroids might be considered, but only for a very brief period, maybe up to 48 hours max, and only in the initial stages to combat severe, overwhelming inflammation associated with life-threatening aspiration, like trying to stabilize a critical patient.
So very limited. Emergency use only for steroids.
Exactly. Their routine use is generally discouraged.
Which brings us to things that are specifically warned against or have bad interactions. What shouldn't be used?
Okay, the source is quite clear. Diuretics water pills are generally contraindicated.
That seems counterintuitive. Wouldn't they help remove fluid from the lungs?
You'd think so, but the source explains they can actually dry out the airway secretions. This makes the mucus thicker and harder for the body's natural clearance mechanisms, the little cilia lining the airways to move out the debris and infection. So ultimately, they can hinder recovery.
Huh. Okay, no diuretics usually. And corticosteroids beyond that initial brief emergency window.
Definitely contraindicated beyond that initial stabilization phase. Using steroids longer term, or even just past that initial 24-48 hours, significantly increases the risk of secondary infections taking hold or worsening, which is already a major concern with aspiration pneumonia. They suppress the immune system.
Right. Any important drug interactions to be aware of?
Yes, the source notes one specifically. Certain antibiotics, namely fluoroquinolones and chloramphenicol, can interfere with how the body metabolizes and clears some theophylline derivative bronchodilators.
So if you're using both.
If those drug classes are used together, the dose of the theophylline bronchodilator likely needs to be reduced, maybe by 30–50%, or the dosing interval stretched out to avoid potential toxicity from the bronchodilator building up. Good communication between pharmacy and vet team is key there.
Okay, so very careful. Medication selection and management is crucial. What happens after the initial, more intense phase of treatment? What about follow-up, prevention, potential complications, and the overall prognosis?
Yeah, follow-up monitoring is really key, especially with repeat chest x-rays. The source suggests repeating x-rays fairly frequently at first, maybe every 2 to 7 days, to track whether the pneumonia is resolving with treatment. Then, maybe space them out to every 1 to 2 weeks until they look completely normal again.
And what if things don't improve on the x-rays or the pet signs get worse?
If the clinical signs aren't resolving as expected, or if they seem to get better for a bit and then worsen again, it strongly suggests either the pet has aspirated again, or a secondary bacterial infection has developed, maybe with resistant bacteria, or the initial antibiotic choice wasn't quite right. The source advises, in that situation, repeating some of those diagnostic tests, particularly the airway wash for culture, maybe even bronchoscopy at that point, to figure out what's going on and adjust the treatment plan.
Prevention seems like it would be absolutely critical, especially if an underlying cause was identified and might still be present.
Hugely important. For patients known to be at high risk, maybe they have megaesophagus or laryngeal paralysis. Specific preventive steps can be taken, especially around risky times like anesthesia.
Like what?
The source mentions potentially giving a medication called cisapride as a slow infusion before anesthesia. It may help tighten the lower esophageal sphincter and speed up stomach emptying, possibly decreasing reflux. Also, it recommends thoroughly suctioning out the esophagus right before removing the breathing tube after anesthesia is finished. Get anything out that might have pooled there.
What about giving antacids routinely to at-risk pets to prevent that harsh acid burn if they do aspirate?
That's an interesting point the source touches on. Antacids could, in theory, reduce the severity of the chemical lung injury by making any aspirated stomach contents less acidic, but UT.
There's always a but.
There often is. The source notes that decreasing stomach acidity might actually increase the risk of bacterial overgrowth in the stomach, meaning more bacteria could be aspirated, potentially increasing the risk or severity of the bacterial pneumonia component.
So it's a trade-off.
Exactly. If we connect this to the bigger picture, prevention strategies often have these kinds of trade-offs. You have to weigh the potential benefits against the potential risks for that individual patient and their specific underlying condition. It's not always a simple answer.
Makes sense. What are the main potential complications of aspiration pneumonia besides just not getting better?
Well, secondary bacterial infection is very common, as we've discussed. The development of that severe acute lung injury, or ARDS, is a major potential complication in bad cases. Less commonly, the source notes that abscesses, pockets of pus or granulomas, which are inflammatory masses, can form in the lungs as a chronic consequence.
Okay. And finally, the bottom line. What's the expected outcome, the prognosis? What should someone realistically anticipate if their pet gets this?
The prognosis, or the likely outcome, really hinges on 2 main factors, according to the source. First, how severe the pet's clinical signs are when they first present. How sick are they initially? And second, perhaps most importantly, whether that underlying cause of the aspiration can be successfully identified and managed or corrected. Severe aspiration, especially leading to ARDS, can be a very serious, life-threatening condition, and the source states it can unfortunately be fatal in some cases.
And the risk of it happening again. Recurrence.
Recurrence is considered likely, potentially very likely, if that underlying problem, the megaesophagus, the laryngeal paralysis, whatever it was, isn't addressed or significantly controlled. That's precisely why finding and managing that root cause is so fundamentally important for the pet's long-term health and well-being.
Well, this deep dive into the source material has really illuminated just how complex aspiration pneumonia is. It's clearly not just a straightforward lung infection.
Yeah.
It's about a failure in the body's crucial protection systems and this whole diverse range of underlying issues that can cause that failure. The source makes it crystal clear that treating the pneumonia itself, the antibiotics, the oxygen, that's only part of the battle. Finding and managing that root cause seems absolutely essential.
It really underscores how often veterinary medicine involves being a bit of a detective, doesn't it? Looking beyond the most obvious symptoms, the cough, the breathing trouble to find that hidden driver, the underlying problem that's causing everything else.
Absolutely. So thinking about that long list of potential underlying causes we discussed, many of which, as you said, aren't immediately obvious, and the source's strong point that recurrence is likely if that cause isn't fixed.
Yeah.
Does this condition really highlight the critical importance of that thorough diagnostic workup, digging deep to find the why, even after the pet starts breathing a bit easier from the initial pneumonia treatment? What really stands out to you about that whole diagnostic challenge?